Hi everyone, I'm Rachel Rector. My intended career path is veterinary technician. The first word I picked is Granulomatous Meningoencephalomyelitis. It's also known as GME. It's a problem with inflammation of the brain, spinal cord, and meninges, which is anything from the scalp into the membranes above the brain. The breakdown of the words. The first word is granulomatous. So the first root is granule, which has to do with granules. Second root is oma, but it has a T on it, so it's omat. Has to do with mass, tumors, or fluid collection. The suffix is os, which means pertaining to. And then the second word, the first root is meninges, meningo, which it has to do with meninges. The second root is encephalo, which means brain. And the third root is myel, which is spinal cord or bone marrow. And then the suffix is itis, which is inflammation. It has to do with, in the vet techs or vet world, it is a big problem with small breed of dogs. It's treated by corticosteroids, but there are alternative medications that are a lot more expensive. There's also alternatives for dogs who are allergic to corticosteroids, but all of the alternatives are a lot more expensive. It does cause seizures, the Granulomatous Meningoencephalomyelitis. It causes seizures in dogs, and typically vets just give them seizure medication so that it ceases. I have a picture of, I guess, a CAT scan of a dog's brain. This area right here, down through the spinal cord, is where would be pretty much becoming inflamed. My second word is Necrolytic Dermatitis, which is it's pretty much skin decay on dogs. The prefix is necro, which means death. Suffix is lytic, which is to reduce, destroy, separate, and break down. The second word, root is dermat, which means skin, and suffix is itis, which means inflammation. It's kind of uncommon in dogs and is really rare in cats, but when it does occur in dogs, it's around the muzzle and then the eyes, the paws, and genitalia. So most sensitive areas of their skin, pretty much, like the sensitive points, get the problem. It's caused by a high glucose level, so it's really common in animals with diabetes, pretty much. It's just like there's not enough circulation to the areas, so it breaks down the skin. These treatments are based off of individual problems. Like if a dog has diabetes, they're going to mostly treat the diabetes and then give pretty much ointments for the skin problems. Here's a picture of a dog with it. See, around the eyes, it has skin that's becoming pretty much crusty is what it'll look like. And then around its snout right here, on like the most sensitive areas of it. And those are my two words. Thanks for watching.